views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to BronxTalk. According to the Department of Health statistics, 1 of every 3 people in the Bronx suffers from diabetes. In fact, half of the city's 10 neighborhoods with the most diabetes-related deaths are in the borough of the Bronx. And sometimes I think we repeat these horrific numbers about diabetes in the Bronx so much that we lose sight of the significance of them. It's like, sure, everyone knows the Bronx is the epicenter for diabetes. Well, beginning this month, there's a new effort to fight the scourge of diabetes in the Bronx with the opening of the Diabetes Relief Center at 3rd Avenue and 148th Street right there in the hub. What's most important is that this new facility is also bringing a new treatment for diabetes that has shown remarkable success around the country. And so tonight, we're going to meet 2 health professionals who are working with the Diabetes Relief Center. We're going to learn about how this treatment works, and we're going to try and shed some light on how they and me and you can have a real impact on this disease that does affect so many in the Bronx. It is groundbreaking, it is eye-opening, and the Diabetes Relief Center could very well bring, well, relief to people with diabetes in the Bronx. So please join me in welcoming to BronxTalk the Chief Medical and Science Advisor of the Diabetes Relief Centers of America. It is Dr. Jack Lewin. Dr. Lewin, thank you for joining us.
Gary, thank you.
Excuse me. And the Director of Diabetes Education and Healthcare Professionals Liaison, RN Carolyn Gershenson. Nice to see you.
Thank you. Thanks for having us.
Ms. Gershenson, let's start with you. Why do we have the scourge of diabetes to such a degree in the borough of the Bronx?
I think it's part due to the populace of the Bronx, the density of the population, and diabetes is prevalent everywhere, but in the Bronx we do have a lot of people, so I think that plays into it.
So certainly the large populations doesn't mean every population has it. What are the factors in our communities that really bring this out in people?
So I think that, you know, the nutritional factor in the Bronx, there aren't a lot of healthy food choices, and I think the accessibility to good food choices just aren't there, and that is a huge factor. And then you have the genetic factor. So you don't know who has the genetic marker for type 2 diabetes, and that plays a huge role as well.
How important a role does health education play, and kind of having people understanding what it is that they have and how it is they're going to try and get better, or what they need to do even themselves to treat it?
Well, there's been numerous studies done on diabetes education and the effect on people with diabetes and the relationship with outcomes. So education is very important. The time spent with a patient where the physician only has about 15-20 minutes, diabetes educators have sometimes upward of an hour, and that's important, playing into the patient's understanding of the disease entity and what they need to do to move forward.
And I guess according to what you're saying right there about health education, that goes back to your original point about population. If you have a lot of people, it becomes more and more difficult to educate them and you know, help them learn about what they need to know. Dr. Lewin, when you see people or treat people, even prior to this very interesting Trina method, what has been good about previous treatments of diabetes, and what has not worked out that this new treatment is trying to fill the spaces
Sure.
with?
You know, so for physicians, nurses, and other health professionals, we've been focused historically with diabetes on the control of glucose levels, of sugar levels in the body, which everybody knows get adversely affected with diabetes. And the focus has been on that, plus something called hemoglobin A1C, which is a kind of a surrogate measure of how your sugar levels vary over time. And supposedly tight control of glucose, keeping in the normal range, not letting it go too high, preventing it from going too low, which is dangerous.
That's why you get an insulin shot, and so many people do it themselves.
And of course there's type 1 diabetes where the body doesn't make insulin or doesn't make makes very little insulin, and there's type 2, which is the acquired type that is the majority of the patients in the population. But both kinds of diabetes respond to this new approach, which was developed by a guy by the name of Ford Gilbert in Sacramento. His daughter had type 1 diabetes and was very, very ill as a child. And he just dropped his law profession, gave up his practice, sold his practice, and became a PhD in human physiology to try to help. What he learned, and what I think has really impressed me, is that the focus is on the metabolism of carbohydrates rather than just the control of a glucose level.
You probably want to break that down for laymen like me and for others who are watching who may not understand that as part of their normal vernacular.
All right. So in diabetes, we have trouble digesting and metabolizing carbohydrates, starches. And the result is you don't get the energy, the glucose, into your cells, and that creates depression, tiredness. The whole metabolism changes in diabetes from what is a normal metabolism. The focus of this particular therapy is to reestablish normal metabolism of sugars and carbohydrates in the diet.
And this kind of thing has never really been done before because, as you said, the traditional treatments are simply to manage the glucose level.
And one of the disheartening things about our approach to diabetes in Western medicine has been that despite all this effort and the research and so forth, even when tight control, quote unquote, when you're really keeping the sugar levels in a very narrow range, like closer to normal, unfortunately people with diabetes still often progress to some of the comorbidity side effects like kidney disease, heart disease, disease of the eye, the retina, and
leading to amputations.
Nerve damage in the legs, neuropathy that leads to amputation. So the one thing about this treatment that's so exciting is that while the diabetes doesn't go away, people still have to take medicine to maintain their normal diabetes control. What happens with this particular treatment is that these comorbidities are often treated and it can be eliminated. Neuropathy can be completely eliminated. I've not seen that.
Completely eliminated?
Yeah, in 90% of the patients in the research we've done so far, the neuropathy is gone. Or 90% gone. What
I'm hoping, and folks who watch our program, all these years, know that we try to present things that get people to say, "Well, wait a minute." So, if you are one of the, 1 in 3, a third of the Bronx that has diabetes, or you have relatives that have diabetes, I hope you're listening very carefully because it sounds to me like, and again, I'm a layman, there are real opportunities here to really take a new look. So we're going to show some pictures. Let's do that first. Let's show a photograph of where this new thing is going to be located.
Great.
It's a full center, and I have seen it, as you know, and it's down on 148th, on 3rd Avenue, right at 148th. So let's take a look at the outdoor pictures so people, when they walk down the block, 200,000 people pass through the hub. So it's right there on the 2nd floor of that building at 2825 3rd Avenue, right? And then Dr. Lewin, just talk about what will Diabetes Relief Center have inside there, and then we're going to show a picture as well that is going to make people feel comfortable and also provide treatments.
There will be, of course, it's going to be a really comfortable environment with 10 or 12.
And we do have a picture of that, so let's put that up.
Big, easy chairs kind of thing, a really, very comfortable chairs to sit in. People will be connected to a very small scale IV, and they'll receive treatments, 3 one-hour treatments of a challenge of carbohydrates.
When you say three in one sitting?
3 in one sitting.
So it's 3 hours?
It's 3 hours with a little break in between each of the treatments. And the body actually learns a new, normal metabolism. It's like teaching the body normal metabolism. The patients have an effect that lasts up to 3 weeks. It starts off gradually extending to 1 week between treatments and then 2 weeks between treatments. Some people go 3 weeks and a month. But we can actually measure the changes in metabolism from the diabetes metabolism to normal metabolism. People start feeling great. They feel better. Well, they have to come in for this treatment. It takes 3 hours with a little break. Maybe.
So you have to make a commitment.
You do.
We're going to ask Ms. Gershenson about that in a minute.
But the good news about it is most insurance, Medicare, pays for the treatment. FDA has approved the specialized insulin pump that we use in the treatment. So all that stuff's been done. And there are centers around the country already that have had this practice going for a long time, but it's been undiscovered. In medicine, one of the amazing things is it takes, on an average, 17 years between when we learn something new is therapeutically beneficial to when we actually apply it.
Yeah, well, we ain't got that much time.
We don't have that much time.
And so we're going to do it, right now.
But fortunately, it's been around for a decade or so.
The trials are showing that it works. You say it's been
Exactly.
working all over the country. This is the first diabetes relief center in the Northeast and the East Coast. Tell me where we're at.
They're in California, Arizona. There's some, a few in Texas, and there's some in Alabama, Mississippi, a few other states.
So guess what? And Bronxites know this. Everything's been invented here, and so
it's coming from west to east.
From west to east this time. Right?
Yeah.
Fair enough. Talk to me, Ms. Gershenson, about this, quote unquote, the sale. How do you now 3 hours? How many times? Once a week? Twice a week?
For the first 3 months, the average patient needs to come once a week.
Once a week, and
then
you spend 3 hours.
Yeah, then it can be once every other week. But look, while you're there, you could be reading a book, talking to friends, doing your emails. You could be doing business work if you wanted to. You're in a very comfortable setting, and we'll have evening hours.
I want to talk about that in a second, but
Okay.
We'll get to that. Hang in there.
Sure.
Because I've heard about this and I really want to understand it. But first, talk to me about people who are busy people who are working people. I guess they could do it at night, right? In an evening, they could come by. That would certainly make sense. Or if they had work a little later, they can weekends. You could do that kind of thing. What would you say, or what will you be saying to Bronxites to say, you know what, this really you ought to do? Like, how do you convince people that maybe this is something they ought to try?
Well, I think that first we will present the results that have been gotten in other centers, and I think that's number one. When people see the results that have been achieved, they'll want to be part of this,
right?
Without a doubt.
And there's no question that people have been suffering and people have been dealing with it. We have actually you guys have a video, or Diabetes Relief Center has a video that I want to show. It's about 2-3 minutes long. And it gives you firsthand description of people saying, wow, it really works. And I watched it earlier today and I watched it a couple of days ago. What I love about the video is that people said they felt better immediately. And that fits right in with what Dr. Lewin is saying. So let's take a break. We're going to roll this video. Take a look. And if you have diabetes or know somebody with diabetes, look a little more closely than anybody else. Let's see what it looks like.
There were days when it was all I could do to drag myself to bed.
I've actually been suicidal because of my diabetes.
I had a numbness and a burning sensation in my feet.
So I had my first treatment, went home and took a 2.5-hour nap. And when I woke up, I said, there's something different.
I come every week. I've been doing it over 3 years. I travel about 85 miles one way, and they make me feel very, very good. When I walk in, I sign in. They take vitals, which includes blood pressure, temperature, and weight. I come sit in a comfortable chair, and then they hook me up to IV, and they check my glucose, and then I drink a sugary drink. They connect me to a pump, which feeds microbursts of insulin directly into my bloodstream. While I'm connected, the staff frequently monitor my blood sugar and vitals. My individual care was monitored by a clinician, and they give me a lot of time and care as I go through the process. Once the treatment is done, they disconnect me. It takes about 3.5 to 4 hours. The experience is extraordinary.
I may not look it, but I feel younger because of treatment. I mean, truly.
After I started the treatments, my depression went away.
Since I started going to Trina, I have noticed that I have a lot more energy. I have little or no leg pain. It is just a true joy to wake up every morning.
After the treatments, I was able to do almost anything I wanted to do.
To not have to fear anymore. It's just wonderful.
In all probability, Trina will give you a positive result if you will give them a chance.
Well, there you go, as testimony from people who have used it, and we certainly hope that many more Bronxites will. Let's talk about what Dr. Lewin was talking about, because I know you're kind of on the social service side with it. This whole idea of sitting there for 3 hours. Listen, I can tell you in the Bronx we're busy people, right. But there's something valuable about that. What can be done in those 3 hours, and how does that fit into the treatment?
Right. So although it sounds like patients are sitting in the chair for 3 hours, they actually will be ambulatory. So they'll be able to get up, walk around, socialize with other patients or other clients there, and we will utilize a lot of the time to do diabetes education. So, which is an important component. We will teach carbohydrate counting, we will teach food values, how to correctly take medication. We will pair with their primary care physicians and or their endocrinologists. We are just an adjunct to what their physician is doing. So we will be in communication with their physician and then serve as an adjunct.
I'm trying to think of when it was. It must be a year or two ago, maybe even further back. We did a program about diabetes, and we watched some health educators go through some of the Bronx communities. And the misunderstanding of what it was, people who had it said, well, they thought it was, like you had a sore throat and you could take a pill and, it kind of like, kind of goes away. This whole education piece is a very large piece. And even if you get these treatments, you still need this education piece?
Absolutely. Absolutely, 100%. The treatment is one part, the education is another part. So they exist together.
And give me the whole package of, now we talked about 3 hours, let's see, once a week? Right?
Then twice a month.
Then twice a month after how many months?
After usually 3 months.
3 months.
It's measured in terms of the progress. We actually can measure the change in metabolism from diabetes kind of carbohydrate metabolism to normal metabolism by the ratio of oxygen and carbon dioxide in exhaled breath with a kind of machine, because there's a difference between the two groups of people. And so we can measure when the metabolic changes occur during the treatment, and then how long they last between treatments, which determines the interval between one treatment and the next.
And I'm going to ask a strict physician about the health education piece, because they're going to be dealing with this treatment over time. What kinds of medical, nutritional, and other things do you want them to know while they're going through this treatment that might assist in the process? In other words, it's a magic bullet on one end. On the other hand, I'm guessing that you still gotta be smart, right?
Yeah, look, this treatment has the profound effects on preventing the progression of the comorbidities, the things that really go wrong with your kidneys, your eyes, your heart and vascular system, the nervous system, particularly in the lower extremities, and the ulcers that form. It really prevents the progression for the vast majority of patients. And that's great, but diabetes is still there. And it's really important for people to think about diet and exercise and attitude and so positive thinking as well. And this goes along with it. I think, as Carolyn said, the treatment's really fantastic for what it does, but we also want people to be healthier. The beauty of it is, the patients, when I first went out to understand what this was about, I went out to California and interviewed a lot of patients and the founder and so forth. I was amazed that each one of the people I talked with said they just felt better. And they hadn't been walking or exercising, and now they were doing that. They were eating better.
And so one thing kind of leads to the other.
Yeah, and I always thought that the priorities in health are attitude, exercise, nutrition, almost in that order. And when the attitude gets better, and people with diabetes carry a burden with them with this disease. And when they start to feel better about their future,
then they're more clear-headed about those other elements that Ms. Gershenson and her
and they're willing to take on some of that stuff.
Talk to me also, Dr. Lewin, about the medical profession and other doctors and how this has been received elsewhere, and more importantly, in your interactions with people in the Bronx. Because the medical community, and especially in the Bronx, I mean, we're pretty strong. We have we believe some of the best hospitals in the nation, and it is our biggest industry in the Bronx. Are they receptive? Is it a hard sell to the medical community? You talked about 17 years to get to a point where they accept it. Where are you at in the quote-unquote sale of this to the medical profession? And I'm mostly interested, of course, here in the BX.
Right. Well, look, physicians, I hadn't heard about it until a year ago. And I
hadn't heard about it for a couple of months ago.
And I was obviously skeptical when I first heard about it. I went, oh yeah, I'm sure. Wait, why wouldn't I know about this?
Right.
But that's just the fact. The founder of this, a PhD, Dr. Ford Gilbert, he got it for his daughter and some members of his family, and then it just spread by word of mouth, if you will. And only recently, only in the last couple of years, has some retrospective research been done. Now we're launching prospective research out of the University of California, so we're going to have much more data and much more information about it. But one thing is clear: the people who have been going through this therapy, giving up, 3 to 4 hours every other week, are going to say, every one of them going to say, this has helped me a lot.
Finally,
something's really happened, and I feel really different about it. That's what really sold me. But now we're actually measuring neuropathy changes, and we've seen in a very large number of patients, more than 90% of them, with unbelievable improvement in that. That means they're not going to have ulcers and amputations.
Can you imagine? I mean,
yeah.
If what you say is true, I have no reason to doubt it. Look at what we'd be saving, and certainly the loss of sight, the blindness, and all the very difficult things we've had in the
Yeah,
past.
look, we also saw in the same population a shocking almost reduction in their need to go to the emergency room or the hospital, because we can look at comparative populations of people with diabetes and there's any number of comorbidities, and we know nationally what the statistics are for hospitalization and for emergency room use, and the reduction with people that have been on this treatment is 90% less.
Wow.
So something really as good is going on here, and we have a lot of measures.
And
but
so what are doctors saying? Are they saying, "Oh, good idea, Jack," or what are they saying?
Whenever I talk to physicians who are hearing about it for the first time, they're absolutely interested.
Really?
One thing that's really important is that we want the patients to remain with their existing primary doctor if they have one.
You're not taking over, so to speak.
No, this is a treatment, but they still go back and see their physician for their regular care. But I think that the doctors in the Bronx are being invited out to a continuing medical education program.
Yes, we should talk
coming.
about that. When is that? And that's coming up like soon. When is that?
That's October 11th. And it's going to be a big deal. It's a great. I mean, it's going to be at the center. It'll be it'll be right at the place where people can come see it. So we want the physicians of the Bronx to understand
we have
this is there.
full page about that. So folks, Lindsay and others, if you can put that up and get the information.
Yeah, that's going to be an important point. But then we're going to continue on. We're going to reach out to podiatrists because they see the people with the diabetic foot ulcers that end up with amputations. We want them to know about this. We want the neurologists who deal with the neuropathy stuff, and the doctors who deal with kidney problems, eye problems associated with diabetes, and heart problems. So we'll reach out to the medical community and let them know this is available. One really important point: people who have prediabetes or very early diabetes that's relatively controlled, they don't need this therapy. This is for people who are having serious problems with comorbidities, real health risks.
Yeah, and which brings up what I really want to ask Ms. Gershenson, and it's almost like asking you to prove a negative. Do you have a sense that there are many people out there who may have diabetes, number one, who don't know, or know and say, you know what, I've just been living with this and I'm just going to keep living with this? Do we have a sense that there are people who could be watching us right now who are, I know I've had it, but I've never really dealt with it?
And that would be yes to both.
Yeah.
We're sorry to say.
Yeah, that would be yes to both. And what I would say to those people, if you're having issues, if you're having complications, you might want to seek us out.
Mm-hmm. The other thing which what Dr. Lewin said that inspired some thought, that if you have this or getting treatment for this, you know what, it can start to lead to, you talked about people starting to feel better, being able to work out. You probably can also start to say, well, you know what, I've had this problem, and now you're engaged, you have 3 hours to sit and talk, and there are people who are sympathetic and all that kind of stuff. You might be able to kind of get a lot of stuff corrected, so to speak.
Absolutely.
So talk to me right now, if you would, Ms. Gershenson, about, I guess really to make the pitch. So who should be listening real carefully to us, and then how should they respond?
Well, I think there's a variety of people who should listen and listen carefully. I think those patients who have not been seen for their diabetes in quite a long time,
People
who are
I
having
referenced just a moment ago.
exactly, who are having complications that they know of, who are not doing well, I think they're candidates. I think patients who are seeing their physician and who are having issues are candidates. So I think that it's certainly worth a call.
Yeah.
So if you're having an issue, give us a call.
Yeah, we're going to. I'm going to ask Dr. Lewin a final question, but we're going to roll there. You're getting the information on the screen. Step back for a second, if you can. I know you're an advisor and you're very involved in it, but where does this fall in kind of like the medical discovery realm in your profession? Like, is this a big discovery? Is this kind of a nice another little treatment? Give me some perspective on it.
It really is a game changer. It's
a game changer.
It's an absolute game changer. And the thing is, there is a physiologic basis behind it. The human pancreas, where the islets actually secrete the insulin in our bodies, the way the pancreas works is it creates a little blast of insulin every 5 to 6 minutes when you've had a carbohydrate meal, when you've eaten a lot of sugar-containing or starch-containing food. It doesn't do a continuous infusion like we've done in medicine, or a subcutaneous and under the skin infusion of insulin. It's a little blast every 5 minutes, which has an effect on the liver, and the liver then starts producing enzymes that metabolize the sugar and sends a message to all the rest of your body.
You can talk about this for a long time, but no longer on this show. We're done. Dr. Jack Lewin, thank you so much.
You're welcome.
And Nurse Carolyn Gershenson, thank you so much. Folks, I hope we can, maybe it is a game changer, and if it is, we're going to try and invent it or help invent it here in the BX. Thank you so much for your time.
Thank you.
And thanks for what you're doing to help people be healthier. If you have further questions or comments on anything you heard on tonight's show or anything going on in the Bronx, then email them to us at BronxTalk@BronxNet.org. You can send us a tweet or post them on our Facebook page, and we'll read them on the air during a future edition of our program. And by the way, if you get to me and you have a question about this, I will make sure that you get an answer. You can also check out Bronx Talk's archives at BronxNet.org. You can find Bronx Talk by following the Watch menu on the new BronxNet website. Now, next week, hold your breath, we will be celebrating the 23rd anniversary of Bronx Talk with a program about the Bronx Photographers Collaborative, who have their Capturing the Bronx Gallery exhibit opening this month. We'll show some great photos, give us all a wonderful perspective of our home borough of the Bronx. Thanks to these folks, thanks to our producer Lindsay, the director William, and we will see you next week. Good night.